Joining us for this news briefing, we're going to go now live to McAllen, where Governor Abbott is visiting the McAllen Convention Center, where it's been being turned into a COVID-19 treatment facility. We're going to take you there live right now.
Would be working with local officials to ensure the hospital capacity and healthcare needs of everybody in this entire region is going to be met. One of the strategies to achieve the insurance of care for everybody who needs care is opening up facilities like this. I want to thank Mayor Darling for opening up this convention center. It is a well-done product. I don't know if you all had a chance to take any videotape of it, but we did get to see it and get to see the beds that are located in there. Currently, there are approximately 50 beds that are up and operational, and they are receiving their first patient as we speak right now. There is the capacity to add additional beds as needed based upon the acuity level of the particular patients. And so this is going to be a very effective relief valve as needed for local hospitals, whether it be in Hidalgo County or the surrounding counties, to make sure that hospitals will not be overloaded. Hospitals will be able to fully address all of the health care needs of the patients that arrive at those hospitals, knowing that overflow facilities like this will exist to take care of additional patients. Also, at this very same time, there is a similar facility like this that is opening up in Cameron County, in Harlingen, I think is where it's located, and to make sure that the needs for those in Cameron County will similarly be met. Bottom line is this, and that is that the health care needs of the people in this region are first and foremost among our priorities in the state of Texas, and this is one of the strategies that we are using to make sure those health care needs are being met. We did have a chance to visit before coming out here and get up to speed both with regard to the response of this region to Hurricane Hannah, as well as the ongoing needs of the region with regard to responding to COVID-19. One thing that we talked about was the need to have a quicker turnaround in COVID test. And Chief Kidd will be working with Judge Cortez as well as with other local officials to make sure that we are able to expedite the turnaround of those COVID tests, knowing how important getting the information back is. But bottom line is we remain engaged at the state level to assist local officials any way we can to make sure that the needs in this region are being met. I want to thank Senator Hinojosa, who is one of our state leaders leading the effort on the ground here in this region. And I thank him for his leadership here as well as for his leadership in Austin, Texas. I want to thank Mayor Darling for what he does, as well as Judge Cortez. And Judge, I will pass it off to you at this time.
Thank you, Governor. And on behalf of all of our people in Hidalgo County, we want to thank you and Chief Kidd for your leadership in getting this facility here. As you know, for the last 3 or 4 weeks, we've been speaking about trying to solve the problem of decompressing some of the hospitals that were near or at capacity. And so this has been a very welcome relief for us. But not only do we thank you for that, but we thank you for for caring about our people. This is the 3rd time that you've been here in the last 3 weeks. I know because I've been with you 3 times, so I can count to 3. And we appreciate that because everything takes leadership. This is not an easy problem to solve. It's going to take a lot of different steps to hopefully solve this problem. But we're very happy for your leadership and your support of the Rio Grande Valley. I think we're getting closer and closer every time we meet about identifying the needs and the solutions to that. And we thank you for that, Governor.
Judge. Who's next? Mayor?
Well, Governor, it's always great to see you. Unfortunately, it's always not something that's good we're seeing you for, and we've been seeing you a lot lately, so that's not good. But having said that, we appreciate, our community appreciates what you do for us and all you've done relating to the flooding, and in this case, the COVID virus, and dealing with that. We couldn't do without your support, and we always count on your support. I never envisioned that our convention center, with all the great things and fun events we'd have, would turn into a hospital, and in this case, acute care hospital. And here we are in less than a week, and so that is really a tribute to your team and what you do for our area. And I'd like to thank Chief Kidd on the great job he does. He travels with you, and he gets it done. I mean, if I could afford it, I'd hire him away, but I know you wouldn't let me do that. Undoubtedly, we need the help, though. Today at 11 a.m., we had 324 new cases at 11 in the county and 45 fatalities. And certainly, may God bless and comfort the families of those people the families that we lose someone every day on this. Those numbers are a horrible reminder that our citizens need to mask up. They need to stay home as much as possible, and they need to avoid gatherings, even small gatherings, even if it's among family members and friends, because that's what spreads it. So I know that's your message, and we appreciate you putting that message out statewide. And so we thank you for that. Thank you for being here. I might do something to say the census. It's important for the census to be filled out, so while the press is here. And we also have a blood drive in McAllen. We encourage citizens to give blood. It's very needed, especially in this time of COVID. So, Governor, thank you very much for being here. Appreciate it.
Thank you, Mayor. Senator?
Thank you, Governor. First of all, we all face a huge challenge, probably the biggest challenge of our lifetime. And for us, working together is key, teamwork. I always said that Governor Abbott has visited the Rio Grande Valley more than any other governor in the history of the state of Texas. And now, when we most need help to take care of our residents who are in dire need of health care, he has shown his true leadership and true colors in terms of responding very quickly to make sure that all our residents are taken care of and take care of their health needs. I'd also like to thank our chief, named Kidd, who heads the Texas Division of Emergency Management. He's excellent, very knowledgeable, and very rapid to respond to all our needs. He's one of the key persons in our state response to this pandemic that we presently face. And of course, Judge Cortez, who is our leader here in our county, doing such a great job in responding to the different crises, different hotspots that we face. And thank you, Mayor Jim Darling, for being active and helping us provide the convention center to house a hospital that will house up to 250 beds, making sure that we have and meet the needs that our residents need. And for us, it's so key for us to work as a team. By that I mean the federal government was helping provide and finance the hospital to the state leadership, like Governor Abbott and Dan Kidd, to our county and our cities. It's important that we all do our part, have our share on making sure that we fight this pandemic. And our public to follow CDC guidelines and wear a face mask, keep social distancing, avoid groups, and wash your hands on a regular basis. Working together as a team with the leadership that we have here in the state of Texas with Governor Abbott, we'll be able to succeed to take care of all the health needs and get our economy back on its feet. Thank you so much.
Thank you, Senator. Chief Kidd.
Thank you, Governor, and Senator, thank you for the kind words. I'd like to start by acknowledging the city and the county leaders that are here with us and those that are not here that have made all this come together in a very short time period. I must thank the captain of the Highway Patrol that's here, our Disaster District Committee Chair, for his work in coordinating all of the state agencies. Our hospitals here, then the staff that have been working those hospitals around the clock, day after day, week after week, month after month, taking care of patients. We hope this facility will provide some relief for them as well. Our private sector partners, the private nonprofits that are out there, the dedicated team, men and women, the nurses and the doctors that are in the other part of this facility taking care of patients that are transferred in here. The setup and the teardown crews, it is a machine that runs. We have over 7,000 personnel assigned statewide to this incident right now, and the far, far majority of the providers are right here in the Rio Grande Valley. As the senator said, we still need to follow the direction of the doctors and the public health professionals about wearing your mask, about washing your hands, about social distancing. More and more we're finding about this virus, about how it spreads, and we can control and we can contain it. The governor tasked us with providing personal protective equipment, PPE, for providing testing supplies and staff. And Governor, we stand ready to continue to do that.
Thank you. We'll take a few questions, but before we do that, I do want to emphasize one thing, and that is people in the Rio Grande Valley must understand COVID-19 is not leaving this region, this state, this country anytime soon. There's only one thing that you can do to make sure that your family and your loved ones don't get sick and don't get harmed by this disease. And that is, whenever you're around them, be sure and wear a face mask. Whenever you go out into public, be sure you wear a face mask. Constantly sanitize your hands as you go out to work, or as you go out to dinner, or as you go to the grocery store. When you return home, could be to your mother, could be to your grandmother. You could be exposing them to anybody with whom that you contracted the disease from when you were at the grocery store or at a restaurant. And if everyone in the Rio Grande Valley can follow the best health practices of wearing a face mask, sanitizing your hands, keeping your distance from others, staying at home, if at all possible, then we will reduce the loss of life. We will reduce the number of people who have to come into hospitals, and we will reduce the number of people who contract COVID-19. We'll take a few questions. Yes.
What kind of assurances can you make that the contact of DCFS won't put any unnecessary stipulations that would prevent local hospitals from sending patients here, like what happened in Laredo at the right weekend, where they only had 8 patients, but they have 106 beds?
Sure. Chief Kidd will address that.
Yes, ma'am. So that is a combination and coordination with the actual hospitals. The Red Roof Inn was not designed like this facility is to take the higher level of acuity patients. Patient safety is our #1 priority, but that is a patient transfer decision from the sending physician to the facility receiving physician. At the Red Roof Inn, it was a much lower level of acuity, just like you wouldn't take a trauma patient to an urgent care clinic, you take them to a trauma center. So multiple levels of health care that we're working with right now. This facility was built in mind for a higher level of acuity than the Red Roof Inn was. We are encouraging our local hospitals as well through our public health authority here to work with the facility to make sure the right patient gets the right care regardless of the location. Again, absolutely. And as you probably know, there are a lot of organizational structures within a hospital. Your chief executive officer, your chief medical officer, your physicians, and the nurses. Our goal is to provide to the county and region-wide a mid-level care facility here. And while some may want to transfer a higher level of acuity, that would be, again, just like the doctor-to-doctor transfer in any other healthcare facility. And so we've worked with Mr. Eddie Olivares, the Director of Public Health here. He has reviewed the criteria, and he has agreed with the criteria for this facility. And I'm not saying that this is a one and done. As time goes on and we see patient needs change, we will readdress criteria.
About how many weeks, maybe months, are we expecting to keep this center open, and what type of COVID patients will be housed?
I'll take the first crack at that, and that is the goal would be to keep this open as little as possible, because the only reason for this location is because the local hospitals have so many patients. Our goal is to work collaboratively to reduce patients. The way we reduce patients is to have fewer people contract COVID-19. So if we're able to achieve our collective goal of reducing the spread of COVID-19, we will reduce the load and burden on the local hospitals, and locations like this will not be needed.
What's it going to cost to run this operation? It's my understanding that the facility alone is going to cost $200,000 a month. How much is it going to cost, and who's going to pay for it?
Sure. Chief Kidd will know this.
So the cost will also depend on the number of patients that come in, and I don't have an exact dollar amount for that. But the funding provided for this will be part of the FEMA funding and the CARES Act funding as we work through this together. And again, depending on how many patients, how long we're here, that's kind of a hard question to give you the exact answer for today, but all that will be open records and public information when we're done.
Speaking about FEMA, public assistance, has it been granted for the Rio Grande Valley?
I can answer that question as well. So under the President's emergency declaration, that provided funding for emergency response. At the state level for Texas, we need about $38.5 million of uninsured public loss. From Hurricane Hana, we have seen about $4 million actually reported right now, so we're nowhere near our federal mandated threshold. And I'll go ahead and answer the question for individual assistance, which is the money that goes to homes and homeowners. We need over 800 homes, major damage or destroyed. FEMA defines that as 18 inches of water in the home about the electrical plug outlet that do not have flood insurance. And so far, we've registered less than 400 homes, right at 400 homes, that actually have water at the electrical plug outlet line. And even then going back for the insurance clause. So we're a long way away from additional federal assistance for Hannah.
May I add just a quick point, if I
Sure.
may, Governor? We as a state are spending about $100 million a week responding to hotspots throughout the state of Texas. And a lot of that portion is for the Valley.
I don't believe that the second part of the question was answered online. If you could just answer that part about what type of COVID patients would be out here.
About the type of COVID patients?
Are they going to be people what? I mean, how dire is this? Is it going to be like a hospice setting? Is it going to be people that are in the center? They're going to kind of go back home?
Yep, so they can be on oxygen. They will work on the vent itself, but they will not be patients that are sent here to pass away or to go into any sort of hospice. These are patients that we fully expect to recover.
So there's people that are going to recover. They're not like they need to be in ICU, but it's still in hospital.
No, the ones that need to be in ICU, we want to stay in ICU. This is that step down from the ones that actually need to be fully vented, one patient to one provider ratio. This is a patient that shouldn't be as sick as somebody that's in an ICU, and somebody that, again, we fully expect to recover and go home. Yes, ma'am.
Señor juez, en español, por favor, ¿podría decirnos el efecto que ha tenido el toque de queda que se ha establecido en el condado de Hidalgo, por favor?
¿Mucho otra vez?
El efecto que ha tenido, si ha tenido un efecto positivo el toque de queda en el condado de Hidalgo, si ha tenido algún efecto positivo.
Claro, ahorita estamos muy agradecidos al gobernador que ha estado aquí con nosotros, que vino aquí y nos consiguió esta facilidad que tenemos aquí en este lugar que se usaba para convenciones, porque ahorita vamos a tener 50 camas aquí, que si los hospitales les faltan camas para mover gente, las van a poder mover por aquí. Eso es un gran éxito para nosotros y estamos muy agradecidos del gobernador que nos haga este favor.
Governor, about a month ago, humanitarian aid organization tried to do something similar here. It didn't work out. Can you shed some light what happened there?
I can shed some light. However, the person who negotiated with them and worked with them and came down here with them was Chief Kidd, and he would have a wider breadth of information about it.
Yeah, so Samaritan's Purse is a great organization. We've had several calls with them. They've visited the Valley twice. When our conversations with them, they felt that we had enough resources here to work together without their additional resources. And we're very appreciative of their efforts. Not sure that we wouldn't use them in the future if we needed them, but the mission that they were specifically designed for was more austere and more critical than what they witnessed here and what assets we were able to provide that kind of relieved the stress from their mind.
I could add to that. It wasn't as if they were either going to help or not help this location. There were other pressing needs. One was in Florida. I can't remember the other state. But they had to decide which location faced the most urgent situation that they wanted to respond to.
And that was not the Rio Grande Valley.
I don't know where they finally decided to go, but obviously we were able to open up this location as well as open up the location in Harlingen, do some other things that were able to make sure that the healthcare needs of the people in this region were going to be able to be met.
On the flooding, sir, is that what you're asking about?
Yeah, on the flooding and
Yeah, so we know that the way that the valley is built and the drainage creates some challenges. And the message that I would have is if your home did not suffer damage, now is the time to go and get flood insurance. There's a 30-day waiting period to get flood insurance from the time that you sign up. There is no guarantee of FEMA individual assistance after a major disaster. But with a flood insurance policy, you're always guaranteed a payout. We'll continue to work. We have great volunteer organizations down here that have been working to clean up and help people rebuild and recover. But, you know, Flooding is a serious problem in not just South Texas, but all of Texas. And you helping us get the message out about paying attention to the weather, doing things around your home to make it weather ready. Our local governments do a great job of cleaning out as much of the drainage and irrigation districts ahead of storm as they can. But when we get tremendous amounts of rainfall and we have flooding, we really need people to pay attention to the local elected officials' directions.
Along those lines, I will add that when I was here last week, we talked with Senator Hinojosa as well as Senator Lucio, the county judges, County Judge Cortez, County Judge Trevino, and others. We talked about the broader perspective that Senator Hinojosa is heavily involved in, and that will be the larger picture of the role that Texas and the federal government can play to reduce the flooding in the region. You see this time and time again, and we will be working in Austin, Texas on some larger base solutions so that we can try to reduce the repetitive flooding that we see in the region.
All right, that was Governor Abbott speaking in McAllen at the McAllen Convention Center, where it is being turned into a COVID-19 treatment facility. He was speaking along with some other officials there, as well as some local leaders. We will be having much more on this press conference a little bit later in our regular broadcast that's coming up on CBS 4 Valley at 5. We'll see you then.